It's Mrs. Jimmy and my 5-year-old son Matthew.
Good evening. My name is Dr. Rahman, one of the treating doctor in this suburban clinic. This is Rimi. What brings you here today?
Yeah, doctor, I came to you with my 5-year-old son Matthew. Actually, he was discharged from your emergency department 2 days ago. I was reported him with the complaints of waking frequently at night with coughing and his troubling breathing when running around. And last week, Matthew developed a cold with low-grade fever. And for the last 2 nights ago, he had a severe bout of coughing and breathing difficulty and wheezing. Now, with these symptoms, I rushed him in our emergency department and he was treated with nebulized and salbutamol. And then they discharged my son. But actually, I'm very much worried about what is the condition my son has.
Oh, Mrs. Rimi, I am really sorry to hear that. I know you are passing a very frightening situation as your son Matthew has diagnosed as a case of bronchial asthma, and
Mhm.
he had a severe cough, deep breathing difficulties, wheeze, and low-grade fever. So I can feel your pain, Mrs. Rimi. So, Mrs. Rimi, can you please tell me what you learned in the hospital uh, during hospital admission?
Actually, doctor, I did not learn any little much more about what is asthma, or what's the conditions my son actually has.
Okay, well, Mrs. Rimi here. Let me explain about asthma. What is asthma? As you
Mhm.
know, for more clarification, I want to inform you that asthma is a condition, a respiratory system disease, where narrowing of where our airway was airway become narrow, and our respiration cannot uh, uh, cannot work properly. Respiratory system cannot work properly, and as a result, there are some symptoms that develop like shortness of breath and wheezing. Is it clear to you, Mrs. Nimi?
Yeah, doctor. But I want to know one thing that will Matthew always have these conditions?
All right, Mrs. Rimi, you raised a good question. It is not always like that. You It is usually as you control over 8 or 10 years of age, and for that
Mm.
you need to take care of your child and just follow a few things strictly and avoid always try to avoid the triggering factors that increase his episode and try to assess his severity of symptoms like respiratory rate, respiratory distress pattern, and you need to take uh, urgent advice from hospital or doctor if you think it's an urgent situation. Inform your school, inform Mithu's school about his condition, and always give him salbutamol inhaler so that he can use in the emergency department, emergency situation. Am I clear so far, Mrs. Rimi?
Yeah, doctor. Actually, please could you tell me how to manage my Matthew's asthma for long run?
Thank you, Mrs. Rimi. Uh, yeah, let me explain you how to manage your son's asthma condition. First thing, I assure you that its prognosis is very good, and you can control his condition uh, uh, by avoiding triggering factor, what you know, which factors contributing his symptoms or and know exactly what is the acute situation, and if Matthew's having any distress or severe cough, and cyanosis. In that case, you need to support from asthma action plan, and arranging early review with nearest doctor, and also take medication regularly, and avoid his avoid respiratory tract avoid to mixed with other children those have respiratory tract infection. So
Mhm.
how does that sound, Mrs. Smith?
Ah, yeah, that sounds okay. But doctor, could you help me, my child, in other way?
Sorry.
Could you help my child in other way, in spite of the advices that you are given to me?
Okay. Yeah, Mrs. Remy, uh, you can take advice or take uh, suggestion or support from
Mm-hmm.
your nearest hospital, and as well as asthma action plan, uh,
Mm-hmm.
and asthma team, and some from knowledge from some leaflets in your nearest hospitals. So,
Mm-hmm.
so
Okay, doctor.
do you have any more concern, Srimi?
No, doctor. Thank you.
Okay, so wish Mithus rapid recovery as well as good control of asthma. And here is our contact detail. Please do not hesitate to contact with us if Mithus having any issues. So thank you.
Thank you, doctor.